topic is Suffering in Silence, Overcoming the Hidden Struggles of Bladder Cancer Caregivers. Caring for a loved one with bladder cancer is an incredible act of love, but it can also be overwhelming, exhausting, and isolating. Caregivers spend hours each day helping with medical appointments, treatments, and daily tasks. Yet their struggles often go unnoticed. Many feel guilty about their own stress and emotions, leading them to suffer in silence. Beacon is delighted to have physician assistant Ms. Reena Cherry, senior physician assistant from UC San Diego Health, who will highlight her research about the unique challenges faced by bladder cancer caregivers. Reena has a distinguished career spanning 24 years serving the oncology community. She has worked as an expert clinician at two of the nation's most prestigious healthcare institutions, MD Anderson Cancer Center in Houston, Texas, and UC San Diego Health in her beloved hometown. With a deep commitment to compassionate patient care, Reena also dedicates her time to supporting the needs of informal caregivers who are an essential component of our healthcare system. Reena received her Bachelor of Science degree in psychology from Spelman College in Atlanta, Georgia, and her Master of Science degree in Physician Assistant Studies at Baylor College of Medicine in Houston, Texas. I am now going to turn the webinar over to Reena, who will highlight why caregiving can feel so difficult, the emotional toll it takes, and suggest practical ways to find support and balance. Reena, thank you for joining us.
Thank you so much. Let me share my screen. Okay. All right. All right. Well, first I want to say thank you to Beacon for inviting me to speak this evening and for just showing, creating a space really for us to talk about caregiving. I'm just so excited that Beacon found value in this topic. I'm very passionate about it, as I hope you will see. But our caregivers tend not to have a safe space to talk about these things. And so I just am so appreciative that Beacon has given us a platform to do this. And I also want to thank all of you. So thank you for being here together on this webinar. And I hope that something that I have to say tonight will be of value to you. As Patricia said, I've been an oncology PA for over 25 years, and I've worked at fantastic organizations, and we've done an extraordinary job supporting patients. But over the years, I really did see a huge void in our support and really acknowledgement of caregivers. And it just kept gnawing at me that there were these extraordinary people who in many ways are the backbone of bladder cancer and backbone of healthcare in general, and we weren't acknowledging them or even trying to figure out how we could support them better. So this talk was really born out of a desire to shed some light on the extraordinary work that caregivers do, and also start to talk about some of the ways that caregivers struggle. And almost across the board, all caregivers do struggle. So I'll start today. What we're going to do is I'll give you some information about caregivers in the United States. So I'll share some data with you about that. We're going to dig into what exactly caregivers are doing on a daily basis to support our bladder cancer patients. I'll talk to you about why caregivers tend to struggle. So we'll get into some of the feelings and emotions behind caregiving, and then I'll talk about ways we can help. So to start, I'm going to share a parable with you. Here goes. So there are these two young fish swimming along when they meet an older fish swimming in the other direction who nods at the fish and says, "Morning, boys. How's the water?" And the two young fish keep swimming along until finally one of the fish turns to the other one and says, "What the heck is water?" Now, the meaning behind the parable is this. Sometimes the most obvious, important realities are the hardest to see and talk about. And when I heard this, I immediately thought about caregiving. we all know caregivers. We have a peripheral idea of what it is they do to support our patients. But this is a very difficult topic for us to talk about. And one of the reasons it is so difficult is that in order to have an authentic conversation about caregiving, it requires that we acknowledge certain feelings and thoughts that we have, and it requires that we acknowledge certain physical and clinical realities about our loved ones that we're supporting that we wish were not so. And in order to talk about those things, we have to move into a vulnerable space. And I've learned over the years that most human beings avoid feeling vulnerable at almost all cost. And since the topic of caregiving requires that we be vulnerable, we tend to sidestep it. So again, today, I'm going to try to help us peel back those layers so that we can create a safe space for us to talk more openly about this important subject. So we'll start with a definition of a caregiver. A caregiver is a person who tends to the needs of another person with short or long-term limitations due to illness, injury, or disability. And caregivers are they're many times significant others. They are our sisters, brothers, aunts, uncles. Parents are having to take care of one another. Children are having to take care of their parents, etc. Friends also provide a lot of support and care for our bladder cancer patients. Now, when I was doing research about caregivers, I had the fortune of stumbling upon the National Alliance for Caregiving. The National Alliance for Caregiving is a coalition of nonprofit organizations that came together in about 1996 to amass some of the most accurate data that we have about caregivers in the United States, and also in an effort to amass some of the best resources and research opportunities we have to continue to study and determine ways that we can support our caregivers. Now, the National Alliance for Caregiving partners with AARP, and they conduct a survey once every 5 years or so. So their most recent survey was conducted in 2020, and they compared that data against the survey they did in 2015. Now, as an aside, I've actually reached out to the National Alliance for Caregiving, and they are assimilating data right now about where caregiving stands in 2025, and we should have that information available to us in 2026. So hopefully I'll be able to present that information to you early next year. But as of 2020, here were the highlights of their research. Number one, there were approximately 53 million caregivers in the United States, and that was up from 43 million caregivers in 2015. So caregiving is definitely on the rise. Number two, 24% of caregivers reported that they support more than one patient. So I want us to be clear. Most of us, when we think about caregivers, we assume a one-to-one ratio. And many times that's not the case. There are many caregivers who are supporting more than one patient, which is an enormous undertaking. And I hope you'll understand how enormous that is in a little bit. But many caregivers are supporting multiple patients. Third, about 45% of caregivers reported a financial impact from caregiving. So there are many, many caregivers who have to reduce their footprint in the workforce or leave the workforce entirely in order to absorb their caregiving responsibilities. And that's obviously a significant impact for the individual caregiver, but it also impacts their families. And so this is a significant, a lot of times caregiving comes at a significant financial cost to the caregiver. And last, the data showed that as of 2020, 61% of our caregivers in the United States were women versus 39% who were men. So those are some of the big highlights from the 2020 survey. All right, so when we look at caregivers in action, we're obviously focused on our bladder cancer patients, but I wanted to give you a scope of where caregivers come into play across the medical landscape. So certainly we have caregivers who are providing support um, before and after surgery, during radiation, and before and after chemotherapy for our oncology patients. However, caregivers are also significantly in need when we start to talk about the dementia space. That is an ever-growing population of people, unfortunately, and caregivers are really having to step up to the plate to support those patients. Certainly patients who suffer from end-stage diabetes, end-stage renal disease. There are patients who have significant cardiac issues, end-stage congestive heart failure, patients who have had stroke or traumatic brain injury, and also, patients who are suffering from a neurologic disorder such as Parkinson's. So this is not an inclusive list, but certainly gives us a broad perspective of where caregivers are supporting patients across the board. With respect to our bladder cancer patients, caregivers are at the forefront and they're with the patient from the very beginning of this diagnosis. So certainly with patients who are undergoing their initial cystoscopies and bladder biopsies, we have caregivers who are supporting patients throughout BCG installations, which, as we all know, can last for weeks to months. Certainly patients who need surgery and or radiation to treat their bladder cancer, caregivers are obviously in play. And then I also wanted to mention little things that we tend to overlook where caregivers are a tremendous support. So many of our patients have Foley catheters. We have many patients who have ostomies. We have many patients who have percutaneous nephrostomy tubes, or tubes that go into the kidney and drain the kidney. These are all things that need to be managed and monitored, and caregivers are doing this every single day. Um, I would be remiss if I did not mention emergency room visits. So emergency room visits happen frequently. Obviously, our patients who are acutely ill sometimes have multiple ER visits. And just to put a finer point on it, an ER visit can be uh, multiple hours. Sometimes we have patients who sit in the ER for 6 to 8 hours at a time. And ERs across the country are packed. So there are patients who spend days in the ER before they are given a bed and admitted into the hospital. And we should also be present to the fact that caregivers, the intensity of care they're providing increases in the days leading up to that ER visit. So most patients become ill at least 2 to 3 days before they end up in the emergency room. And the caregiver is having to care for the patient during that time and make decisions about, is it appropriate to take to the ER? When do I take to the ER? What are the symptoms? Calling the clinical care team. So the intensity of the work they do rises, the patient gets to the ER, and then that care continues throughout the emergency room stay, throughout that inpatient stay, and then in the days to weeks afterwards. So ER visits is huge. Certainly patients who are, more acutely ill, who require support in a skilled nursing facility, caregivers are still very much involved. And then, unfortunately, for patients who need hospice or at the end of life, that is one of the most intense, physically intense and emotionally intense periods of time for caregivers. So this kind of gives us, I hope, a better idea of what our bladder cancer caregivers are doing for our patients.